Hi, how are you? My name is Anthony Barrett. I'm a facial plastic surgeon in Miami, Florida, and I'm here today with a patient who I recently performed a revision rhinoplasty on about a month ago, who underwent a procedure several years ago and was unhappy with the long-term results of her previous rhinoplasty. Given the history and the deformity that we were starting with, my recommendation was for a rib rhinoplasty to harvest rib cartilage from her right chest wall to use to help her with the aesthetic goals that she would desire. That was in part also due to procedures that she had had previously, which did not allow us to use ear cartilage. That being said, we're here with our patient. This is her preoperative imaging, her profile view. As you can see, her aesthetic goals were she had a scooped out appearance of her profile, elevated tip, which was overly rotated, essentially what is called a foreshortened nose. So this is very often seen with reductive rhinoplasty procedures, where someone who had, let's say, a hump has a removal of that hump and it was too aggressive, and that causes not only a lowering of the dorsum, but also subsequently weakening of the tip cartilages, and that causes a what we call a rotation of the tip in an upward direction. And it's not as evident, obviously, on frontal view because of the two-dimensional quality of the imaging. But as you can see, her tip is round, amorphous, and you can see a lot of nostrils on her front view, which goes along with what our findings are in our profile view. So now here we are. If you could, 1 month post-operatively. She obviously has, a degree of swelling, which will settle down over time, but the dorsum was elevated with a rib cartilage graft, which allowed for the elevation of her dorsum as well as the refinement of her tip. Her tip cartilages were once again sutured in a more less rotated position and refined as well, and that allowed for both not only refinement of the tip, but for elevation of the dorsal septum, of the dorsum of the nose, which also provided for, if you could, sorry, permit me one more time, for a nice little super tip break, which will continue to define itself, obviously, since we're very early in this procedure. Martha says that she did not have a lot of pain following the surgery, given the fact that some patients are a little intimidated by rib cartilage grafting. But do you feel like was it a very painful procedure?
No, not for me. It was very, soft pain. I just, I could sleep good. I think the first night it was the only night that I was like with a little bit of discomfort,
Mm-hmm.
but because of the surgery. But after that, I could sleep good, and I never felt too much pain.
Good. So great. So there you have it. Hopefully we'll have the opportunity to follow Martha as her swelling resolves and see further refinement of her tip and dorsum. Thank you very much.